Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, which of the following statements is true about mifepristone? In mifepristone, it is also called as Ru486. It is a 19-nor steroid and it acts on the receptors and it is used for menstrual regulation. So, what are the true statements about mifepristone? It is also called as Ru486. It is 19-nor steroid and acts on receptors and used for menstrual regulation. It is given orally also. Then major sources of androgen in females are all except. If you see major sources of androgen, adrenals, ovaries, and also adrenals will produce androgens, ovaries will produce androgens, and also peripheral conversion to androgen precursors in the liver, gastrointestinal tract, and adipose tissue. These will also produce androgens, but corpus luteum will not produce androgens. Then the side effect of clomiphene citrate, because of which its use should be immediately stopped, is the side effect of clomiphene citrate because of which we should immediately stop the usage of clomiphene citrate is visual symptoms. See, visual symptoms are serious and they should be immediately stopped if anyone notices visual symptoms with clomiphene citrate. Then if you see these, the most common side effect of clomiphene citrate is menopausal symptom. The side effect for which its use should be immediately stopped are visual symptoms. The most dreaded side effect is ovarian hyperstimulation syndrome. Chances of ovarian hyperstimulation syndrome is less than 1%. Chances of multiple pregnancy is less than 10%. And maximum dose is 100 milligrams and duration of use is around 12 months. So all these are important points about clomiphene citrate.
thank you and thank you for watching.